Many of you may know that my sister was very ill with Lyme disease for over 10 years. She was bedridden. I witnessed what she went through, many months of misdiagnosis. She went untreated. She was filming a movie in Los Angeles. She was in a small part in Nixon, and she got very, very sick. And we didn't know what to do. And so we took her all over the country, and every doctor said, we don't know what this is. We don't know what this is. We don't know what this is. And at that time, we were living in Greenwich, Connecticut, and a neighbor of ours said, have you tested her for Lyme disease? And we said no. And so we did, and she came back with a positive result. She also had 2 co-infections, and it destroyed 10 years of her life. At that point, I watched her deteriorate, and I called my friend Debbie Siciliano, who is the co-chair, co-founder of the Lyme disease group here in Connecticut. I said, what can I do to help? And my mouth ended up getting me on the board of directors. And I will tell you that it was the most rewarding experience of my life. I witnessed people who have gone through such tragedies. People don't understand the depth of Lyme disease and the fact that it can affect every single part of your body. There is nothing that Lyme disease will not attack or affect. After I'd been on the board for several years, I became sick with Lyme disease. I was sick for 3.5 years. I had an IV port. I gave myself IVs every day, etc. Thankfully, I got past that. Chris, my husband, who has lived on this island in the summer for 28 years, has never had a problem until last summer. I came home one day and he was shivering uncontrollably in bed. And he said, I am sick. And Chris never complains. I took it seriously. I put him in the car, we went to the hospital, and Chris was diagnosed with babesiosis. The very next day, our dog Shadow, who is our child, all of a sudden she was on the ground, not moving. We picked her up, took her to the Officer Animal Hospital, and she was diagnosed with anaplasmosis, which is another tick-borne illness. And I said to Chris, as fortunate as we are in life, and we have a beautiful home, a beautiful life here in Nantucket, I said, we have to do something to make this more aware on this island, which is where this all started. And so last September, we approached the Lyme disease group in Greenwich, which is the Global Lyme Alliance, and said we'd like to do this. And they jumped at the opportunity to come here. With that, I thank you all for coming. I'd like to introduce the CEO of the Global Lyme Alliance, Scott Santarella.
Thank you so much, Will and Chris, for your hospitality and for inviting our organization here to speak with all of you, and thank all of you for your support in purchasing some tickets to support the work that we're doing. The story that Will described is one that we hear probably 100, 125 times a day from all over the country. In fact, actually from all over the world. We have received requests for help and or support from people in 40 different countries. So to think that this isn't a global epidemic, we'd be kidding ourselves. And if you do an overlay of a map to piggyback off of your dog getting sick, if you do an overlay of a map where pets get Lyme disease in this country, because veterinarians track Lyme disease a lot better than most doctors do, the entire country lights up. So if you think you're living in Iowa or Michigan or Arizona or Texas and you don't think you're going to get exposed to a tick and Lyme disease, you're kidding yourselves as well, because your pets are. And where do pets go? In your house, and you pet them. They're on your bed. They're on your couch. So Will's absolutely right. Every one of us is in a situation that we could at one point in time be affected. And so Global Lyme Alliance was created by actually 3 women, Debbie Siciliano, who's here, a good friend of her, Diane Blanchard, and then a woman in Westchester, Stacy Groden. And as a husband with 2 daughters and grown up with women my whole life, when you want something done, you get a woman to do it, right? So They started that 15 years ago, Deb. How long have you been doing this? 20 plus years ago. And I'm here talking to you today. And that to me is just an complete injustice, right? There's got to be a way for research and science and technology to come together to solve the problem. And that's the basis of what Global Lyme Alliance does. We raise money to try to fund the most promising research in 3 primary areas. Diagnostic tools. We need a better diagnosis of the disease. And I was talking to a few of you earlier about the misdiagnosis you've gone through for years. We need better treatment options beyond antibiotics, because antibiotics are fraught with a lot of issues using them over a long-term period of time. And we need better discovery to understand the disease and how it impacts our immune system and whether or not it's impacting other diseases that we may have and making those diseases worse. Or is it the Lyme disease that actually is causing those diseases? Autism, Alzheimer's, Crohn's and colitis, you name it, MS. Oftentimes people are misdiagnosed with these diseases and they have Lyme disease. So there's a lot of work to be done. Over the last 5 years, we funded about $12 million, a little over $12 million in research awards to researchers and institutions around the country. We're also initiating some observational patient studies, which are basically looking at Lyme literate doctors that are out there who are treating patients and trying to bring some science-based evidence and data into how they're treating those patients so we can understand whether or not the treatment protocol is working and why, and have some evidence behind that to then go to the traditional medical community and see, we have now data that proves someone can be sick with Lyme for a long time. And we've got some Lyme literate doctors that are treating these patients in a way that's been effective. They're feeling better. They're getting better. So there's a lot of work to be done. At times I feel like we're trying to boil the ocean. And that's just on the research side of what we do. We also spend a lot of our effort and energy, probably about 20% of what we do is educating the general public and trying to help the families that are most sick, especially children. And so we've got a couple of educational programs that we feature. One is called Lyme Link, which we just launched, which is a connecting of a mentor who's been dealing with the disease over a period of time with somebody who's been newly diagnosed. The journey for Lyme disease oftentimes is very lonely. Sometimes patients and their families don't necessarily agree on the disease. And there are oftentimes doctors, and many doctors will tell you that you don't have the disease at all. So we created this Lyme Link program so that we can match those who are the most sick with those that have gone through the journey to give them some hope and some support. We've got a Lyme Literate referral program. If you contact our foundation, we'll put you in touch with a referral of a Lyme Literate doctor that we vetted, that we try to identify in a radius of a couple of hours wherever you live around the country. We also have a program that we provide continuing medical education information and programs to practitioners, physicians, and nurses that want to learn more about the disease, especially those that are sort of in the mainstream environment that are seeing more and more people come to them with symptoms related to Lyme. And then the fourth program that we have that we're proud of is our camp program. We actually go out with a partner, Ivy Oaks Analytics, and we remediate over 200 camps in about 8 states up and down the eastern seaboard and into the Midwest. And then we go into those camps with our ambassador program, and we train the camp counselors and the camp nurses about Lyme disease prevention. And if someone does get bit by a tick, how do you remove it? What do you need to do? And how do you actually take care of the child? So there's a lot happening in a very small organization that's raising about $5.5 million a year. And this isn't a 10 or 20 or $30 million solve. It's probably going to be $1 billion solve. So the fact that you're here helping to support Will and his desire to take this event from here to maybe the country club at some point and maybe to some other spot on the island that's larger, we can't be more appreciative or proud to have us here to be part of this and to tip our toe in the Nantucket waters and be a part of this community and trying to help people that are suffering from this disease. So I can't thank you enough for your time tonight. Yes, Chris.
I've just been reading recently there's been a huge increase in the number of Lyme disease, a lot of diagnoses this year over last year. Can you sort of speak to that a little bit?
I think part of it is the way that doctors are reporting it better now. So there's an increase. You have a lot of debate about this tonight. Lise might have some thoughts on it. Certainly climate change and things like that, I think, are a huge factor. Ticks don't die off in the winters like they used to. They become more, resilient across the board. I also think more people are becoming aware of it and going and getting themselves checked. I mean, our website takes in about 70,000 visitors a month. 70,000 people a month visiting our website. I mean, that's crazy when you think about it, right? And I bet you if you've walked around this deck, everybody here probably knows somebody, maybe knows 2 people or 3 people that have been affected by Lyme. And I can't tell you how many times when I tell people what I do, they tell me that they have Lyme disease and they don't talk about it. It's just stigma associated with disease, which is kind of a crazy situation that we're dealing with, and we really shouldn't be. Yes, question in the back. Sure. The question was about the increase in deer populations and the impact that the deer population has on tick-borne illnesses and Lyme disease, particularly here in Nantucket. The way I'll answer that question is a couple things. One is we're an organization that believes in preventative measures, and we do a lot of our education and information about how to prevent the disease. And certainly one of those is monitoring and taking care of deer populations. Whatever side of the fence you fall on in terms of whether it's humane or inhumane, I think the reality is one of the bigger challenges than deer are mice, field mice, and they're all over the place on this island. Yes. So it's not so much the deer. The deer get blamed oftentimes, and as they should, because you can see them on the deer usually, and you see deer everywhere, but you don't see field mice. But you know where the field mice are? They're in your basements. They're in your attics. They get into your closets and things, and they're actually bringing the ticks into your environment, probably more so than the deer are. There's also things that we can do with sprays, both on ourselves and our lawns, and we're working with a company now that's developing a natural pesticide that we think might be useful, hopefully within the next 18 months to 2 years, that would be really preventative and safe for the environment, safe to put on yourselves, and help to prevent the spread of the disease. There's other projects that are happening too. I think it might be here in Nantucket. I know there's something happening on Martha's Vineyard. Can we alter sort of the genetic structure of a tick? Can we somehow, vaccinate the ticks so the ticks don't pass on the disease? I mean, I think we're at a point now where technology is allowing us to look at some of these things from a science perspective. It's kind of like almost sci-fi to me. I don't know how that would ever really work and how long that's going to take. The challenge we have is we deal with the most sick people oftentimes, people like Will's sister. And those are the people we deal with the most. Doesn't mean that we don't want to prevent other people from getting sick, but most of our efforts are focused on trying to help those that are the most sick. But you raise a great point. I mean, a lot of times we tell people summer flu. If you feel aches and pains, especially in your joints, fever, that's usually a telltale sign that you've probably been bitten by a tick. Arthritic conditions, memory loss, trouble walking, trouble sleeping. And that's part of what makes this disease so hard is it can be masked into so many other types of ailments. So when you go to your doctor and you said, I have all these things, he looks at everything but Lyme. And what we're trying to do is get primary care physicians and regular doctors to look at maybe Lyme being the source of why you're not feeling well. I'm from the school that your body. We know our bodies. And if you don't feel right and you're sick, you got to almost be your own best advocate, right? And I saw this. I come from the cancer research fundraising world. And, cancer research and actually HIV and AIDS really was transformed because people actually became their own advocates and they said enough's enough. And I think in a disease like this and in all of our lives and healthcare in general, your body better than your doctor does. And if you don't feel something's right, you don't feel like the treatment you're getting is making you better, either you go get a new doctor. And the best doctors would tell you that maybe you should go see a new doctor because they're either confident enough in their ability to treat you or they know they can't treat you and you need somebody else. Yes. 2 questions.
Don't you think one of the biggest problems is that the standardized medical tests oftentimes come back negative, and as soon as they're negative, the general doctors dismiss it?
Right.
That's right.
The answer to the question is yes. We're actually working on 2 tests now that we're we're funding researchers that are working on 2 tests now, a blood-based protein abnormality test and a urine-based test that we're hoping might prove more effective. My personal belief is I think it's going to be more than one test. I don't think one test is going to be the identifier, right? Because you got co-infections and other things that are happening. So I think it's going to be a multitude of tests, and maybe Lise can address that in just a second when I bring her up here. But testing is a large part of the challenge here. And one of the things we've recognized in talking to a lot of the Lyme literate doctors we speak to is how you interpret the test, right? Whether you see, a faint line and you want to say that's not really positive, or you see no line and it's not positive, or is that faint line a positive line? So then that puts you over the edge of testing positive. And I mean, and there's some interpretation there, I think. I heard from a doctor, David Carbone, years ago, and he was a lung cancer doctor, had said something that there's an art to the science of treating people. And so you can't just always go by the science. You have to have some feel and some understanding, right? And I think the best doctors out there are ones that spend time in a laboratory, learned about research, became MDs, treat patients, know how to bridge the gap from the bench to the bedside, and have this art of treating patients and listening and understanding that patients do know themselves the best. So Lise is a PhD MD. She works at Boston Children's Hospital, and she's one of the researchers that we fund. And the reason that we brought her here today is she's doing something which is really interesting through emergency rooms. And I think it's relative to the question you just asked about how do you, when someone presents into an emergency room setting or a doctor setting, how do we help them? And she's created a really kind of cool network that I'd love for her to share what she's doing. We're really supportive of what she's doing. And then I'm happy to continue to answer some questions, but I want to give Lise a chance just to share with you a little bit of what she's doing and the impact it's having on hopefully changing the paradigm. What's your name? Phyllis. Met you when you came in. Phyllis's point was that you don't necessarily need the bullseye rash to be sick. And that if you don't have a bullseye rash, but you're still feeling all those symptoms, odds are is that you may have been bit by a tick, because not everybody presents with the peregrine migrans rash. At the flip side of that, some people who do get the rash, oftentimes doctors may say that it's not a tick bite, it's a spider bite or something else. If you're still feeling those symptoms like we've described in terms of what's listed on our website too, I would continue to have yourself checked for having Lyme. All right, I'm going to turn it over to Lise.
So my name is Lise Nigrovic. I'm a pediatric ER physician at Boston Children's. Can you hear me? Or okay, great. And thanks, Scott, for the introduction, and thanks, Will and Chris, for opening your beautiful home, and all of you for spending the evening thinking about Lyme disease. I'd hoped to show some pictures of children, but I'm going to look at my phone to remind myself. So my apologies in advance. I'm going to talk a little bit about some of the work that I've done in thinking about Lyme disease in children. I want to start by thanking the Global Lyme Alliance. I think they're doing really amazing work by funding research, really important research, and having a really rigorous scientific review process to establish which research to fund. And so I think they're doing really important work, and I'm really grateful for their support. So I'm a pediatric emergency room physician. What does that mean? I'm a pediatrician, and I trained in emergency medicine. So I work at Boston Children's, and I see kids with all sorts of things, including Lyme disease. And so my passion and my goal is to make sure that kids, when they first present, often before anyone has thought about Lyme disease, can get appropriately identified, tested, and treated as needed with Lyme disease. So I do a lot of clinician education, and that's where my research is focused. So right in the very beginning, when children first present. So many of your questions are right on, and we're doing a lot of work in that area. There's clearly an epidemic of Lyme disease, and we don't need to convince this crowd. The numbers are staggering. Current estimates are more than 300,000 new cases each year. More than half of those cases are in children. If you look at the age distribution, it's bimodal. So it's middle-aged adults and school-aged children. Peak ages are 5 to 10 years old, with boys affected almost twice as often as girls, presumably because they're spending more time outside, but school-aged children are really affected. I'm a pediatrician. Pediatricians are fond of saying children are not little adults. And I think that's really important when thinking about Lyme disease research, because the vast majority of the research has been done in adults. But kids are different. They present differently. Their tests perform differently. The treatment is different. And so I really like to advocate for including kids at the table when you're thinking about Lyme disease. The geography is important. All of us know the maps that show the clusters in the upper Midwest and New England, including Nantucket. I think the current numbers, and I was just talking with the public health official from Nantucket, but I confirmed this number, that 40% of full-time residents, however you define that, on Nantucket have exposure or tests that show that they've had Lyme disease in the past. 40%. It's just hyper-endemic. And there's also the other tick-borne co-infections that we're just getting a handle on. So this disease is really prevalent. And right now, we don't have good prevention strategies. The clothing probably works. It's not all that practical for children. I don't know if any of you have children. Mine won't wear very much when they go outside. It's really hard to get them to wear that. We don't have a safe and effective vaccine. There is one under research and development in Europe with a European company, but that's many years before it goes through all the testing and hits the market. There's some novel approaches like genetically engineering the mice, treating your backyards, things like that, that may be very helpful, but we don't have the data for them to be ready yet. And so we have this big problem. The diagnostic limitations were so well highlighted. So that if you have the classic rash, then people who are educated about Lyme disease are going to think about Lyme disease. But that rash doesn't always appear in a classic way. So it can appear atypically. I see children a lot where the rash is in the scalp. So it's really hard to see what it is because it's covered in hair, and in a long-haired child, you might not see it. In a dark-skinned individual, the rash doesn't look the same. So it's really challenging even when you have the rash. And a large number of people with Lyme disease don't ever have that rash at all. So that alone clearly is not enough. We have serologic tests which work in many cases, but not all. Particularly early in disease, when you first start getting symptoms, those tests are negative, but you still have the disease. People need to either clinically consider it or retest later. And then once you've been exposed to the infection, your tests remain positive for a lifetime, but yet, and so it's hard to sort out a new infection from a prior infection. So we clearly have big limitations. And that's something I find very interesting. So I had some great pictures, which I'm not going to be able to share you, of some children that I've seen over the years that have been evaluated for Lyme disease, but I'll just try to describe some of the world that we live in where it's first considered. So I just saw a boy probably about 2 weeks ago. It was an autistic boy, 5 years old. He spent every night sleeping next to his dog. And in the morning, the parents noticed a tick in the eyelid. And he ended up in the emergency room because of his autism. It was really challenging to try to remove that tick because he didn't want to sit still. He was nonverbal. He'd been to his pediatrician, and then we saw him in the emergency room. And we have more tricks to help convince children to do things that they don't want to do. And we ended up removing the tick and giving him some doxycycline to prevent Lyme disease. And I think he's doing just fine. And we had a nice educational experience with the mom. But most kids that develop Lyme disease, actually only 20% of kids that get Lyme disease will remember a tick bite. So 80% of the people that go on to have Lyme disease don't remember a tick bite. So the post-tick bite exposure with antibiotics is only going to work if you know you were bitten by a tick. So that's really important to remember. So, it's a good question to ask if you've been bitten by a tick, but it doesn't rule out the possibility of having a tick bite. Another child that I've seen recently is a 10-year-old girl with a swollen knee. So all of you are thinking Lyme disease. We're thinking Lyme disease. But she came in with a fever. It was painful to move her leg. And so there's a clinical consideration of a bacterial infection in the joint. So not all, you have to think about all the other things that mimic Lyme disease. And whereas Lyme disease is treated with antibiotics, a bacterial infection in the joint requires invasive procedures, intravenous antibiotics, potentially surgery. And it's hard as a clinician to sort out which disease the patient has. And so without good tests and tests that are available rapidly to diagnose. And so that's sort of the challenge. And then the other child I was thinking of was a young child with facial palsy, healthy child, 3 years old. The mom had taken him out of the crib in the morning, and she looked like one side of the face wasn't moving right. She gave him breakfast, and he was drooling, and then she definitely knew something was wrong. So she brought him to the emergency room, and we identified that there was a peripheral facial palsy. Now, that can be a Bell's palsy, which is an idiopathic process, or it can be Lyme disease. And if it's Bell's palsy, you want to get steroids to the child. If it's Lyme disease, you want to give them antibiotics. And there's some evidence that if it's Lyme disease, the steroids might make it worse. So it's hard as a clinician. We don't know what they have because we don't have a test that's accurate. We'll come back right away, but yet we have to make a good decision. And so those are some of the challenges that I face, in the acute care of children, and why I feel like we really need a better test and a better approach to the initial management. So my phone is turned off, but what have we done to address that? So starting in 2015, with colleagues of mine at Brown University and DuPont, both in Lyme disease endemic areas, we founded a research network. We call it PD LymeNet. And what we do is we identify children presenting to the emergency room where there's the clinical consideration for Lyme disease. And we approach them to enroll in a study, and we get consent from their parents, and we get clinical information, and if they consent, we get blood, urine, biosamples. And we store them initially at the sites, and then they get transported to Boston Children's Hospital where they're stored. After starting out successfully setting up this network, we were able to expand, and we added a site in Milwaukee, in Philadelphia, in Pittsburgh, and then just this summer out in St. Paul, Minneapolis area. And that, of course, is work that's supported by the Global Lyme Alliance. And so at this point in time, we've enrolled more than 2,500 children undergoing evaluation for Lyme disease. We have clear clinical histories and samples. And that's just a valuable resource so that when we develop these new tests, these new technologies, they can be tested in children so we can see how they do in this important patient population. And so that's something that is very important that the Global Lyme Alliance has been able to help support. The technology is moving really fast. We've talked a lot about serology and some of the weakness of serology. Science and medicine is moving fast. All the omics, metabolomics, and all the different proteomics, transcriptomics. And that's really important technology, and we need to evaluate them for the treatment of Lyme disease. And these biobank, these resources will allow us to do that rigorously and include children at the table, because in the past, all the studies have really been done in adults, which are far easier to include in research studies. I think there's important issues around co-infections. They've been mentioned by people. These same ticks, these Ixodes ticks, carry other than Lyme disease, Babesia, Powassan, Ehrlichia. We don't know who to test or which tests to send. And so there's a lot of unanswered questions about Lyme, but the co-infection unanswered questions, I think, are even bigger. And so we hope to look forward in some of those areas. So that's all I wanted to say. I want to just emphasize that Lyme disease is common in children. More than half of the new cases are occurring in children. As a treating clinician, as somebody who sees these patients all the time, we have to make decisions, and we have to make decisions with imperfect information. But really advocating for thinking of Lyme, getting the tests out, and making sure they're interpreted in the right way. The current tests and what we have available have limitations. That's why we have to do this research to make sure we can develop a better test. And I think by building networks and collaborating, both physicians in different areas, physicians in different fields, and people looking at this problem from different directions, I think that really brings the power to bring a solution. So that's all I have to say. I'm happy to take questions.
Thank you. The one thing I'll say about Lisa's work, which is really important, is the collection of the biosamples is essential
For the research that happens. One of the things that Lise has been really great about as a great collaborator is sharing those samples with other researchers who are trying to do tests to understand the disease better. And the great thing about the way that Lise is collecting her samples is she's doing it with, standard operating procedures. She's doing it, at the highest scientific level that you can possibly do it. And that's important because you want those samples to be solid and really, meet the scientific rigor that's going to stand the test of time if you want to go to publication and or, receive other funding. So the work that she's done in that arena is really, has been a huge help to us as we try to find partners to work with. And Lisa's been a great partner and a great collaborator. She's not someone who works in a silo. He's created a network of doctors to work with, and that's really unique. So I really appreciate, and we really appreciate that. So, questions?
When I think of deer in environments like this in the country. But I live in town, and I learned today that I have a family of 4 living at my house. We just arrived a few days ago. So I have a bunch of little grandchildren that are running around the lawn. What can I put on the lawn to protect them from the ticks? Because my gardener did not know.
Yeah. Well, I am not an expert. I do know we have someone from the Tech of Public Health. Can I put you on the spot? I think before I put him on the spot, though, so the question is about what are the appropriate environmental controls to put on the grass? I'll give him a second to think of an answer, but I also think that in awareness, so if they're visiting you and then when they return to wherever they live, to know that they've spent time over the summer on Nantucket, so that if they develop the signs and symptoms of Lyme disease, that's brought to their doctor's attention quickly. It can be really important. So if they're from an area where Lyme disease is seen infrequently, they may need to remind their clinician that if they develop a rash or a fever later, that could be Lyme disease. So that's the patient-ended question, but I don't want to get out of my zone. And so I'll talk to you. Can I put you on the spot? Why don't you come up here? You didn't know you'd be a guest speaker, but you're in the right spot. So that's the find your expert, right? You want to introduce yourself?
Oh, wow. So,
Yeah.
wow, this microphone's strong, so I'll hold it a little bit off. My name is Roberto Santamaria. I'm the director of the health department for the island that we are occupying right now. So to answer the question about how do we prevent deer is what you're asking? Okay, so what you can put on the grass to prevent children from getting bit. So there are a couple ways to treat it. There is, right now, there are a couple things called the Daminix tubes. It is permethrin treated cotton inside a tube. It looks like a little, how do I explain, a paper towel tube. There's a lot of cotton in it. The mice, which are the primary reservoir for Lyme, the white-footed mice, use that cotton to build their nest. They get treated with permethrin. The permethrin is lethal to ticks. So it kills off the ticks that are on their body to prevent the spread. There's also a type of permethrin spray that can be put onto your lawn. Permethrin is lethal to the ticks, and that's a way to treat your lawn for ticks. However, one of the very important parts about permethrin is because it was made from mums, the plant, the flower, mums are actually highly lethal to cats. So if you own a cat, do not use permethrin spray. In that case, what we would explain is using the oil of lemon and eucalyptus. You can see in a, how do I explain, the off spray, you'll see on there, it says oil of lemon eucalyptus. That spray is not lethal to cats, and you can use that spray on your lawn, and it is not lethal to the lawn either. And you get that byproduct of letting your lawn smell like lemons for a while, and eucalyptus. It prevents the ticks from getting onto you. It's a preventative. It does not kill the tick, but it does drive them away. There is also a product on island, a landscaping product, a group called Oh Deer, actually. They spray a deer preventative on your property to even prevent the deer from getting on the island. So to clarify two things from earlier, the deer, as you were mentioning earlier, calling the deer herd is a way to prevent some of it. There is a push on the island that we have worked with to get sharpshooters to call the deer herd on the island. The issue with that is in the state of Massachusetts, oddly enough, you are not allowed to hunt deer with a rifle. So we are looking to change special legislation to allow that sort of deer calling, a professional deer calling. So we're looking to do that right now, and we actually have a donor willing to pay for the sharpshooters. And the second clarification is, as Chris mentioned earlier, I'm sorry, yeah, I believe Chris mentioned it earlier, the program that we have right now, there is a officer, Dr. Kevin Esvelt from MIT Media Laboratory is using CRISPR technologies, a DNA alteration technology to alter to alter the mice DNA to make them immune to tick bites in general, not just Lyme. So it would be preventative for Babesia, Ehrlichia, Anaplasma, Powassan, on and on, including Lyme. So what we're looking to do, we are actually right now in the clinical stages of it. They are in the animal modeling stage of the genetically altered mice. It is not your Jurassic Park type mice situation. There are already white-footed mice on Nantucket that are immune to tick bites, that are immune to the Lyme disease Borrelia species. So they are taking the mice from the island, amplifying that DNA, putting it into more mice, and releasing that mice onto the island. They are right now just in laboratory stages. They're going to test it on an uninhabited island first as a proof of concept, and then it needs to come to town meeting to allow it to be released on Nantucket as a whole. But we are really hoping. So Lyme prevention, tick-borne disease prevention is more than just one thing. It's not just in the doctor's offices. It's not just in the hospitals. It is at home, treating your lawns, education, prevention, doing the tick-borne disease prevention through the mice, doing the deer calling. There is multiple things. It's going to take multiple approaches to work on Lyme and to prevent Lyme. As Debbie said, and as our CEO said earlier, this is a global epidemic. It is not just endemic to Nantucket. And it is great to see this here and that we're finally going to be able to get a partnership because we all know government funding is very small. So Global Lyme Alliance, in partnership with the Nantucket Health Department, we will be working to move forward to a better and Lyme disease-free Nantucket.
Just say thank you once again to everyone for coming. Oh, there's a question there.
So
Sure.
I have a lot of questions. How much does it cost to do a Lyme disease test? How long does it take to get back? And what's the accuracy level? Which is one question. And then the second question is, and we talked a little bit about this, 15 or so years ago, there was a vaccine.
Right.
Where are those evil big pharma companies in terms of why aren't they pushing to do, given all the research in other places, there has to be a way to identify Lyme disease in a much better way.
Right. The cost structure and the timing around the test, I don't know. Deb, do you know that information? I think it varies, right?
So the commonly employed tests are called two-tier testing. There's something called an ELISA test and then a Western blot. And there's about 20 different ELISAs on the market. They cost between $6 and $50, not very much. And a Western blot, which is an old test, it's a technology from the 80s, that's more like $100. And typically you use the first-tier test to determine who. It takes 2 to 3 days to get the test results back. A lot of it depends on, are you in Nantucket and your samples have to be flown somewhere, or are they doing it locally? But it's days, and for an emergency provider, that's a long time, but for often that's a timely thing. It's a long time because often there's some decisions. Yeah, there can often be a first-tier test. That ELISA test can be done, at a hospital while you wait or within the same day. But the second-tier test is usually done by a regional laboratory, very rarely done by a hospital laboratory. It takes several days. The vaccine issue is really important. I think that's a really important part of the armamentarium. The prior vaccine, which went through phase 3 studies in the 90s, was shown to be effective. It was a really hard vaccine to take. You had to have 3 shots in the first year, which as adults, it was only studied in adults. You've got to go to your doctor's office 3 times in the season before the Lyme disease. And you had to get a booster every 2 years. Every year you had to get a booster. And its efficacy was not perfect, so it was a really hard vaccine to take. It wasn't perfectly efficacious. And then some people were worried that they had symptoms from the vaccine. The FDA panel that reviewed that was not supported. It's a controversial area that I'm not an expert in. But that vaccine was pulled from the market because it was challenging to give. People weren't buying it anymore, and there was some concerns about the safety. A new vaccine would be great. And again, it's a European company that's investigating it right now, but I think it's many years away from being in the market.
And the Western blot were developed back in the day when the IBM Selectric was developed. That tells you how old the technology is. Today's technology puts us in a place where we can go much faster, but we need more money and more research for it. I can't wait to get there.
But the numbers now are so big that you would hope that it would start attracting funding other than
we talked earlier. I think there's and I say this to Debbie all the time. I've spent my career working in cancer research environments, and I feel like Lyme disease and tick-borne illnesses is kind of where cancer was 15 years ago, right? We're on the cusp of some breakthroughs because technology and science is finally kind of catching up to what is seemingly a simple organism, but a very complex disease, right? And so the more science-based evidence we can have on the work that we're doing and biobanking like what Lise is doing, it will attract pharma if they know there's a marketplace that could actually then produce something for that company to be profitable. Now, you may be on one side or the other on that profitability. That's, the way of this country, capitalism. But I think if there was an opportunity for other pharmacological options and things beyond antibiotics, especially when you look at the immune system and immunotherapy drugs and other things that are happening in cancer, I think a lot of it's relative to what we're dealing with Lyme disease. And we're learning more and more there's an immune compromising, situation happening here. How do we actually find the right research to work with? And we need the samples and the biobanking to do the work through. And so the work that Lise is doing is essential for that. It's one of the reasons why we're funding it.
My 7-year-old was sick 20 years ago. it was a real problem, and he was very sick. And I thought if I reached out to our government officials, they'd step in and help. It didn't happen. In fact, I personally think they've gotten in the way. So when we were able to hire this gentleman, Scott Santarella, who fast-tracked research in the cancer world, I was so grateful. It took a lot of resources to be able to get someone of his caliber to work and look at Lyme disease and fast-track it. But it is a hope for all of us on the board and for so many patients everywhere. And we've got to get there. But the one last thing I'll add to that is, for years, many of us, even in here today, found that our doctors would tell us that persisting infection, our children weren't still sick. They had 21 days of amoxicillin. How could they still have a persisting infection? You don't know what you're talking about. But as Scott said here tonight, he said, you know yourself, you know your child better than anybody, and you trust your instincts. And so when our government didn't step in to help our children, and we said, we're going to do it ourselves. And that's what we did. With the little funding we have, we put it on the map that persisting Lyme disease exists. We proved it at Johns Hopkins, and we proved it right up here at Northeastern under the direction of Kim Lewis, top researchers. And other researchers who for so long had this theory that, oh, it's easy to diagnose, it's easy to treat, and weren't really interested in it. Now they see that other researchers have put it on the map as a persisting infection, and it's gaining more, steam. But it takes time and money, and it takes us shaking it up out there. But we're getting there bit by bit, but not fast enough for all of us here today. I know it.
So Debbie's one of 27 board members that are really passionate about what we do, and all of them, as I mentioned, either have had Lyme disease or their kids have had it, or both. I think what we are frustrated with is speed. How do we make this happen faster? We've got to. And it's going to be a collective effort. And quite frankly, it's going to be private funding, right? And we're going to have to do that through foundations, family offices, donors, our patient population that we serve, and the 60,000 people that are visiting our website a month. Those are the people that are going to drive this and solve the problem. And with some luck, maybe we can identify some biomarkers or some indicators that a pharma company might be interested in and see there's a value here in trying to do something good for the world. So, Mr. B-Man.
So, about 6 or 7 years ago, before Roberto was our health head, when Richard Ray was in there was a program with the Cape and the Islands where each town could send 100 ticks up to UMass and Amherst, and they would analyze them for all the different tick diseases. And on Nantucket, it was in the Inky, but we could send 100 ticks. There were only 35 cents. So we could send them up there for free, or it was a grant from the state. So now, this year over on the Cape, the past couple of years, they've had the grant over there, but not on Nantucket or the Vineyard, where you can send your tick in, and it only costs the individual $15 instead of $50. But how can we get involved in the program on the Cape, where I would love to send my ticks off, because then you know if they're infected or not, so we don't have to take needlessly antibiotics, because antibiotics are killing us. We should not be taking antibiotics frivolously, which is what they give us at the hospital now. You have a tick bite? Here, take some amoxicillin or
Well, the program aspects, probably Roberto can answer that better than I can. I had a really bad joke in there about being a tick magnet, but I refrained.
Actually, the program does still exist through the Cape Cod Commission. It's the tickreport.com. And the funding is there through the Cape. They are still including Nantucket in it. They are still taking Nantucket ticks for the $15. That's through actually a donor took care of that portion, because what happened was actually that local government funding was cut. So we didn't have the money in our budget to actually put that extra. What they were asking for was for us to pay into the program this year when the grant dried up, and we actually just didn't have it in our budget. Somebody on the Cape actually paid, so island resident from the summer actually paid so that we can maintain that project. So we are still part of the group. It's just not grant funded anymore.
I tried to do that, but they said, no, you're from Nantucket. You can't send your tick in.
Then I'll have to talk to them.
It was
because
it was a couple of years ago.
Yeah, we are if it was a couple years ago, it might have been when after the grant ended, but this year we are definitely a part of it. And I've been putting it into the budget to try to get it again for next year.
And so what do I do with the ticket I take off tomorrow?
It's so through tickreport.com, you get the shipping label through them. They actually give you amazing, the directions on how to wrap it up, make sure you get it in and you put it in the right envelope and you can send it over. You can bring it to our office, but we're just going to do exactly the same thing. Thank you, Scott.
Thank you, Will and Chris, for hosting. This has been incredible. Thank you all for coming. Questions have been great. And obviously, we're going to stick around a little bit if you want to still talk, but thank you all.